Welcome to the virtual hospital. My name is Mary Trosclair. I'm the coordinator of this area. Just to give you some background information about simulations and how Charity School of Nursing has used simulations, we have to go back 20 years. Back in 2003, Charity purchased its first simulator, and that made us the first generic nursing program in the Greater Gulf South region to use simulations as teaching tools in the curriculum. Since that time, the use of simulations in our program and throughout all of nursing education has greatly expanded. Students tell us that simulations help to bridge the gap between the classroom and clinical, and between nursing school and the actual practice of nursing. Well, 20 years after that first purchase, the nursing program relocated to the new Ochsner Center for Nursing and Allied Health on the City Park campus of Delgado Community College. This new state-of-the-art virtual hospital is located on the second floor of the building. The virtual hospital is configured as a nursing unit, and it's named 2 East. There is a bed capacity of 20, including private rooms, a birthing suite, a pediatric suite, a multi-use, multi-patient room like an emergency room or a PACU. And then we have an isolation room with an anteroom where the nurse dons and removes protective equipment. In the future, we plan to offer interdisciplinary simulations with students of both nursing and allied health. So this would be training the healthcare team of tomorrow together. Basic skill instruction in the nursing curriculum is done by your clinical faculty in small instructional classrooms or in the nursing labs on the fourth or fifth floor. Students are expected, once they've received the instruction, to deliberately practice that skill. In fact, we have studies that demonstrate that if a student practices a skill 9 or more times, it often leads to satisfactory skill performance and the retention of how to do that skill later. Rarely do students learn new clinical skills in the virtual hospital. Simulations are used by faculty to observe students and identify if they can apply the knowledge that they possess and that they learned in classrooms and in those labs. In every simulation, there's an opportunity for students to recognize cues, and a cue could be anything. Could be a change in the patient's condition. It could be a new statement by the patient that was never made by them before. An example would be maybe like a change in blood pressure based on what you received in the report, the handoff report from the off-going nurse. So identifying the cues and using these cues, the nurse analyzes this new data and makes judgments about how to intervene. You may be a little curious, how do we observe you using your knowledge and what you're thinking? We observe it by seeing the actions that you do in response to the situation at hand. We can tell if you are applying the knowledge that you gained in the classroom, and we can also tell if you need to maybe remediate and learn that information again. Now, how do we do it? Each room in our virtual hospital here is equipped with both audio and visual capability. There are cameras, microphones, and speakers in all the rooms. Faculty are observing in what's called a control room, and that is right usually in between the patient rooms. After the care period of the simulation ends, students and faculty reflect on the events and the decisions that the nurse made. This is done in what's called debriefing. Debriefing is a time of reflection when each participant identifies what they did well and what did they clarify by doing this, and what could they do to improve their performance. Another thing that we'll ask and discuss during debriefing is, how was your teamwork? How was your communication? The majority of learning occurs during debriefing. Now, how often will you come to the virtual hospital? Well, your clinical instructor will inform you of the date and time for your human patient simulator simulation. Before the experience, be sure to check your Canvas site for specific instructions regarding this simulation. You may have to print the patient's profile or record. Just be sure you go on your Canvas site under either HPS, which is Human Patient Simulator, or Virtual Hospital, and see if there's anything that you need to do to prepare for the simulation. Now, you are always in the role of the registered nurse. In the simulation lab here, the virtual hospital, you are not a student nurse while you're caring for patients. You're in the role of the registered nurse. So this gives you all the rights and privileges that an RN will have. In fact, when you introduce yourself to the patient, you'll learn soon that we recommend that you use an acronym called AIDIT, and your faculty will tell you about that. When you explain who you are and your title, use the title registered nurse. In actual settings, in actual hospital settings, when you go, you, of course, would be saying a charity student nurse. But in the virtual hospital, your title is registered nurse. You will receive a handoff report from the offgoing nurse. During that report, feel free to clarify any information by asking questions. Take notes, write down data, because you will have to compare the data you collect to the data that was discussed in the report. Now, how can you get the most out of this? You have to suspend your belief. This means that you just have to imagine that this simulated patient is a real patient. You have to believe that you are the real nurse and that all of this is real time. Playing it real also indicates that all professional behaviors that you will learn in the classroom should be followed during your care periods. That includes things like therapeutic communication with the simulated patient, compliance with infection control, wearing protective gear if it's required. If you know that hand hygiene is required before care and after care, and anytime you've been exposed to body fluids, what we expect to see you do is perform hand hygiene. Based on the information received during the report, if special protective equipment is required based on this patient's illness, then use that special equipment. Demonstrate that you are safe, that you are able to use your knowledge and provide safe patient care for the patient and for you. You understand and you can apply your knowledge during this period of time. Another example of playing it real is that you must always uphold what's called the HIPAA Privacy Act. I'm sure you've been exposed to this in your own healthcare, but what this means in a simulation is that as a student, you are not to share the activities or the outcomes or the events of a simulation with other students. So how does it begin? The simulation begins as the nurse enters the room and greets the patient for the first time. I mentioned earlier that we want you to use and follow the AIDED acronym. It continues as the nurse performs both the prescribed nursing interventions and any independent nursing interventions. You will obtain vital signs. You will do a physical assessment, document the data, and then do independent things like offering patient education or preventing complications of immobile patients. No one's going to come in and tell you you're going to be expected to do this independently. You don't need a healthcare provider's order to do this. If the nurse identifies that there has been a significant change in the patient's condition that require communication to the healthcare provider, the nurse should use the phone at the nurse's station of 2 East. There'll be a directory of how to contact the provider for your patient. If the nurse identifies that there's a safety risk or an error has been made, the nurse addresses the situation as soon as possible. When the nurse is finished providing care or performing the task at hand, notify the patient that you will be leaving now. And before you go, as you will learn, always ensure patient safety and patient comfort before leaving the room. When you're finished, find your faculty or myself, the coordinator of the hospital, to provide to us a handoff report. You will learn how to do this. We will even give you tools to help you do it. And so this is the formatting that we would like you to follow. So when the simulation has ended, I want you to go back into the room and restore everything, the patient and the room itself, in the pre-simulation condition. So be sure that you restore the patient's position, his linen, the equipment in the room, anything that was touched or moved, be sure to replace it in its primary condition. At that time, after you're finished, you can go to the debriefing room, which is room 2027, or any other room that your faculty tells you to go to, and then attend the debriefing. All right, so that's our beginning. I'll have another video for you that will tell you the specific features of the simulated patients that you will care for. Until then, happy nursing, and I'll see you when you get here.